Teen and kids. Are they going to be called the quarantine kids, for the rest of their lives?
Yeah.
Think about the impact this is having on their lives. Being in quarantine. Us as adults, we never had to go through this. New research found that 1 in 5 kids showed signs of depression after being quarantined because of this virus. And I'm talking kids in 2nd grade through about 6th grade. So let's get some help here. Licensed marriage and family therapist, Dr. George James, we know him very well, joins us now. Dr. James, good to see you.
Good to see you both. Thanks for having me on.
Again, it's 2nd through 6th grade. What is making them depressed? What are they depressed about?
There's just so many changes, so many different things that are going on right now for young folks. And sometimes it's hard for them to express what they're feeling. They're not connected to their friends. They're not seeing their teachers. They're not able to go out. There's so many different things that this quick change is really overwhelming. And sometimes as parents, we're just also overwhelmed as well. And it's hard for us to sometimes just to be patient and to be able to see that our child or children is actually in a different place. Or sometimes their reactions become so tough for us that we just want them to stop versus us recognizing they might be depressed.
Yeah.
Well, you mentioned reactions. So how can we tell if they are depressed? What are the signs or symptoms?
There's lots of different ways, but especially for children, they can be moody. They can shift from one mood to the next. They can be a little bit more irritable. They could just be overwhelmed. Sometimes it could be where they need more sleep or they're not sleeping at all. These are just things that we typically see. But one of the things we want to do is to help them to be able to express and share their feelings. And there's multiple ways you can do that. That you can have a chart, you can have a graph, you can have a wheel, you can play a game. Lots of ways to help them express what they're feeling so that it doesn't just feel stuck inside.
Oh, so you don't ignore it, like you just said. You acknowledge it and let them get it off their chest.
Yeah, you definitely got to acknowledge it. You have to be able to see it, and then you have to be able to help them to share it. Because as parents, once again, you could be overwhelmed. You could be trying to juggle so much that you miss it.
Yeah.
And that to be able to help them to get through it.
Okay, so let's look at some of the things that we can do to help them get through this. They should be moving around. I know it's hard because we're supposed to be inside, but we should encourage them to be active.
Yeah, one of the things that I've seen is that when kids are at school, they have recess or they have after-school sports. And one of the things that we try to help people who are dealing with depression is to be active in some way, some type of physical activity. So be active at home. And that could be inside. Do jumping jacks, do push-ups, or if you have outside, maybe run around the house, some way that they can be active because they're missing a lot of that, which they would have had in school.
Same thing with adults. I know when I went through my depression, was fighting off depression, they really emphasized getting out, at least walking, just get some physical exercise. How about this? Should you let, even though the school teacher's not in physical presence, should you let the school counselor know, even from ages 2 to or grades 2 to 6? Let teachers know what's going on at my house. Let the school counselor know what's going on.
Yeah, it's important to be able to get as much support as you can. I've seen lots of schools respond in a very good way, where a teacher or a school counselor can be informed of what's going on, and now you can work as a team to support your child because they might be seeing it with the online courses or classes, and now you can work together. And if that doesn't work for you, you can now go and get a therapist or work with someone online, and they can also help you with resources for you and your child.
Hey, doctor, could you come back next week and talk specifically about high school kids, and especially the high school seniors who are not going through the normal traditions that we've all been through in our lives, kind of stepping stones in life?
Yeah, high school kids are unfortunately dealing with a lot of different challenges, and I'm more than willing to talk more about it. But you have to be creative and also give them their space to be able to talk about what's going on with them.
Let's be creative next week and talk specifically about our high school and college seniors too. Thanks a lot, Doctor.
More than welcome.